Can everyone hear me? Is my voice clear?
Yes, it's clear.
Okay, all right, thank you. Okay, Assalamualaikum, good morning and good day to everyone. Thank you for joining this morning webinar. So this webinar for today will be about chemical waste management. And my name is Zul Amal. I am a science officer in Hospital Sultanah Nora Ismail, Batu Pahat, Johor. And I will be our moderator for today. And before we begin our main topic for today, I would like to share a short introduction about this international scientific webinar and also a short introduction also about our speaker today. Okay, I hope you all can see my slide. This is an international scientific webinar, a short introduction. So this webinar is organized by Persatuan Pegawai Sains Malaysia, PPSM, or the English is Malaysian Science Officer Association. So this webinar aims to share knowledge and expertise, bridging gaps between academia, industry, and policy-making bodies. So this webinar is free admission, therefore all are invited to join regardless of profession and background. So if you have any questions or any inquiry about this webinar, you can contact us, contact our committee at our email, pegawaisains.malaysia@gmail.com. The spelling is just like in my slide, PEGSAINSMALAYSIA@gmail.com. Okay, right now I will be presenting introduction about our speaker today. So our speaker today is Associate Professor Dr. Sharifah Norkhadijah Syed Ismail. Dr. Sharifah is the head of Department of Occupational Health and Environment, Faculty of Medicine and Sciences, Universiti Putra, Malaysia, Selangor, Malaysia. Education background about Dr. Sharifah. Dr. Sharifah graduated in 2003 from Universiti Putra, Malaysia, Selangor, Malaysia, in Bachelor Science of Environmental and Occupational Health. And in 2006, Dr. Sharifah graduated Master of Environmental Management in Universiti Putra, Malaysia, Selangor, Malaysia. And in 2011, Dr. Sharifah continued her Doctor of Philosophy in Environmental Sciences in University of East Anglia, Norwich, England. Now I'd like to share Dr. Sharifah achievements. So Dr. Sharifah has been awarded gold medal in a local award in a Putra Innovative Competition, Putra Innovative Carnival in Teaching and Learning in 2019. Dr. Sharifah also has been awarded gold medal in International Award in a third International Innovation Competition in Toronto, Canada, ICANN 2018. And Dr. Sharifah also has been awarded in silver medal in International Award in a 5th Korea Creative Invention Contest, CIC 2018. And Dr. Sharifah has been involved in a lot of various aspects, such as Dr. Sharifah has been published 92 scientific papers, 10 reference books, magazines, and newspaper. Dr. Sharifah also a committee in National Solid Waste Management in Ministry of Housing and Local Government of Malaysia. Dr. Sharifah also is the president for Environmental and Occupational Health Society, EOHS NGO. And Dr. Sharifah currently leading a project on COVID-19 impact on waste management in Malaysia. So without further ado, I would like to invite our speaker today, Dr. Sharifah, to present her knowledge and expertise with us.
Okay, terima kasih. Assalamualaikum. Bismillahirrahmanirrahim. Assalamualaikum and very good morning everyone. I hope you can hear me clearly. Boleh dengar saya?
Boleh, Dr.
Okay, all right. Can you see my slide now? Boleh nampak slide saya clearly? Boleh? All right. Okay. So, okay, that's good. Thank you, Miss Sadia. Okay, all right. So, thank you very much, Mr. Amar, for a brief introductions. I would like to also thank Malaysia Associations of Science Officer of inviting me to share some of the knowledge. It's just like it's a refresh knowledge about me to me as well as to all participants today. And I would like to also to thank all the participants of your time, yeah, to join us in the sessions to gain some of the knowledge. I guess you guys are well versed of the topics because you are already involved lots of, being involved with the chemicals all the time in the lab perhaps, yeah. So, but today we just want to, refresh some of the knowledge about chemical waste management, yeah. Okay, so bear with me. Maybe the talk will be like 30 minutes and then we will continue with the question and answer sessions if you have, yeah? So what I'm going to share with all of us today, so with the participants, is about to create some of the awareness on the safety and health as well as the procedure on dealing with the chemicals waste. So before we start with that, so let us see some of the quote of the day. So I would like to share with us today a nice quote which is I found in the internet. So since we are dealing with the chemicals waste management today, so we can't run away from chemistry, right? So this quote of the day, like, is quite interesting. If life is a chemistry, then boil your ego, melt your sorrow, expand your happiness, enhance your kinetic energy, think like a proton and stay positive. So I guess all of the participants today are positive with me together. So we want to share, to gain some of the knowledge about this waste management, chemical waste management. Yeah. So what I'm going to share with all of you, the first thing first is to understand the definitions of chemicals waste. So what kind of chemicals waste that we are dealing, the type of the waste, what are the risks, how this can affect us in terms of health as well as to the environments. And then we want to share with you about how to manage the waste accordingly, specific to the law and regulations, some of the guidelines. Yeah, I guess most of us have a guidelines in our office, in the workplace, how to deal with it. So that is how where we have to check or reflect back to our practice. Yeah, and then we want to share something about way forward. What are the challenge? How to solve the problems and things like that. All right. So before we go further, so let us see some of the overview of waste management in Malaysia. So in particularly, we have separate managements of waste in Malaysia. So we have this municipal and solid waste, as well as the construction and demolition waste, which is under the managements of Ministry of Housing and Local Government, and it's also under separate laws, yeah, which is Solid Waste and Public Cleansings Management Act 672. So perhaps if you are living in Putrajaya or perhaps you are living in Negeri Sembilan, so you have they have been implemented this law, so you have to segregate your waste at home. So they are a must lah. Kalau kami di Selangor, we are in Selangor, we are not implementing this law yet. So we are not, the segregations of waste is not compulsory for the household. So apart from that, this is the topic that we are discussed today, which is the hazardous waste, the toxic waste, the chemical waste, yeah, that we are dealing in our workplace. So some of us work in the lab, some of us work in the bengkel, yeah, some of us dealing with clinical waste, yeah, in your lab and hospital, for example. So these are the topics these are the separate kinds of waste that we have to manage properly. Apart from hazardous waste, we have this biomedical waste, or we call it as clinical, and we have this electronic waste. So why it is separated from our household waste? Because it is managed by Ministry of Environment and Water, which is under different ministry, as well as under different department and under different Act or regulations. Yeah, so we have this Environmental Quality Act 1974, who will manage this waste, and then this specific Environmental Quality Schedule Waste Regulation 2005 that has specifically spelled out what we have to do. Yeah, in every aspects of the waste. Yeah, I hope that I'm not too fast. Yeah, okay. So, okay, let's see how much that we produce. It's some kind of extra knowledge for us. A little bit, I bring you about the household waste that we produce, and then we will compare it with what we have produced in terms of the scheduled waste or chemicals waste. Yeah. So what we have, most of our waste is come from our household, which is about 65% of them. And then apart from that, we have about 28% come from commercials and institution, which is, I'm from the university. So most of the waste come from university, institute, hospitals, and the rest of it is come from the industry. And the compositions of our household waste mainly is a wet waste, which is about 45% come from food and organics. But apart from that, we have something like we can recycle, like plastic, papers, and glasses. Yeah, it's about maybe 22% of that. All right. Sekejap ya. Okay. Alright, okay. Alright, next Ila. Ni apa benda? Okay. Sekejap saya tengok kenapa ya saya ada notification ni. Sana. Okay. Alright. And then we go back to schedule waste. So how much that we have produced the schedule waste? If you can see the trend, it's increasing by years. Yeah, if we have like 27 is like 2 million tons of waste, schedule waste or chemicals waste, hazardous waste that we are producing from institution, industry, and then towards 2021 we have almost double up, almost 7.5 million tons. So they're increasing like maybe 4.5% per year. And apart from that, we also have this clinical waste is also showing a significant increasing trend from years to years. You can see the numbers from 25 million in 2015 towards 57.4, which is about 60 million tons of waste in 2021. So the increasing numbers of waste that we produce is significantly related to the developments that we have, the populations, and of course with the clinical waste, if we have like COVID-19 pandemic last time, so this also contributes to the increasing percentage or increasing waste generations for both of these waste. Okay. All right, so next I would like to share with you all of these pictures. So how these two pictures relates to hazardous chemicals. So it's quite interesting pictures. You can see in the left pictures, you can see elder women as well as very young women, very beautiful women. Yeah, perhaps you can, if you can see it. All right, so the next one adalah gambar, if you can see a face from the front and also from the side. Yeah, so if you can see it, can you raise up your hand? Yeah. Okay. So how these pictures is relate to hazardous chemicals, or especially with yeah, thank you, Jane. So especially with chemicals waste, yeah. So the chemicals have two sides of it, which is it can be bad, and it also can be good, yeah. So it's like a coin lah, yeah? Depan belakang. So you have like double up. So when you expose to chemicals in a very appropriate way, yeah, perhaps with the PPE, personal protective equipment, you have procedures, yeah, you have control the volumes or the concentrations of chemicals that you use, then it could possibly reduce the risk and we exposed to a very structured or a very good situations. But if you expose more, then you jeopardize your health as well as the environments that you are working with. So that is what the chemicals can work or affects us. Yeah, it's like this picture. And I also like to bring you with some of the chemicals that has been used in warfare. It's starting in World War I. I guess in previous years sebelum World War I pun they already use this chemical. But what I want to share with you is not just the chemicals, but the effects that it can produce to our health. Yeah? If you can see here, the effects is massive. And basically, when you're dealing with chemicals, it will affect your lung, your respirations, that the first attack, yeah, from inhalations. So that is why the chemicals is cannot be used in any forms in the war. So jadi that is how the chemicals can definitely affects our health. Yeah. So what is defined by chemical waste? If you can see in the sentence like excessive or unused, unwanted, meaning that we have buy more, but we have used less, perhaps. Okay? So unused, unwanted of the chemicals that can cause damage to not only our health as well as to the environment. So it can be hazardous waste, it can be non-hazardous waste. It also can be universal or household hazardous waste. So what is defined by the hazardous waste per se? It's a chemicals that can cause bodily harm. It can cause disease, poisoning, Not just that, it also can cause changing in human behavior. For example, you are you feel like hallucinations, yeah, perhaps like fainting, pengsan dan sebagainya. So these are kind of what the hazardous waste can cause us. Yeah. Apart from that, I also noticed that most of us have dealing with lots of other chemicals waste in our workplace. Yeah. For example, if you are working in the lab, you are dealing with clinical waste, you are dealing with laboratory chemicals waste, yeah, in your institution. Yeah. For example, my case, I'm dealing with students, research and things like that. So in the lab, so a lot of acids, lots of solvents, lots of peroxides has been used, heavy metals and things like that. So that's all chemicals that can affect us if we are not control them. And apart from that, maybe some of you is working in the radioactive lab, for example. So that is a kind of radioactive waste that you are exposing to. But of course, you have, I guess most of you have a specific regulations, specific procedures to handle them. Yeah. Okay, so the hazardous chemical can give us two kinds of hazard. The first one is the health hazard, which is penyakit ataupun health hazard, or kind of like acid burn, yeah, poisoning, illnesses that we call as health hazards. Another one is also that chemical that can cause physical hazards, meaning that fires, explosions, yeah. The explosion can cause earthquake. Yeah, sometimes it's very. If you are storing a very big chemicals and something happen, the blast is very big, and it will affect the environment. And apart of that, the chemicals injuries can also depend on the concentrations that you expose. If you expose in very high concentrations, or if you are exposed in very low concentrations, the durations of the exposure, how long that you expose, whether you are exposed too long to it or in a very short times. Yeah, the types of exposure, of course, and whether it can affect, mainly the chemical can affect us through inhalations, yeah, pernafasan, and it follows by the contacts with our skin, eyes, as well as the ingestions accidentally or not accidentally. So apart from that, we also have mixed exposure, meaning that kita kan, when we are working in our lab, for example, we are dealing with lots of chemicals that we don't even know the backgrounds of the chemicals. Of course, we have the chemical safety data sheets, but sometimes we are not really concerned or not even aware what kind of chemicals that we are dealing with. So they are mixed together. Some of the chemicals is a compatible, yeah, compatible, meaning that they can be stored together, they can live together, they can stay together in one room. But some of the chemicals cannot, yeah, they have a very different, they can react together and cause vaporize hazardous gas, for example. So this hazardous gas can affect us when we are in a very confined space, for example, in the room, in the lab, for example. Yeah. And also it depends on the vulnerable groups. For example, if you already have asthmatic, if you are having a coronary disease, for example, or if you are a pregnant lady, you are also among the vulnerable groups that can affect easily with the chemicals exposure. So when we go back to this chemical waste management, there are some historical incident. I guess most of you have aware of it. Yeah, so it just like refresh balik lah, yeah, some of the ilmu or the knowledge. So the example of historical incidents from chemical poisoning, if you still remember, we have Love Canal pollutions, which is the area has been, being a hazardous waste dumping ground, and then they transfer the area to be a residential area. And after a few years, the chemicals get contact with the environment, and then it become precipitate to the walls of the house and affects the residents. And at the end of the day, the residents have to be moved out. But it's too late because it has already affects the children in the residential area. So that is one thing that we don't want to happen. Yeah, Minamata disease, yeah, from the methyl mercury poisoning, which has affects the central nervous system. So this is a massive historical cases that if we are learning about chemicals, this is something like very important for us to know, because the chemical can bioaccumulate, they can biomagnify in our food chain. So that is how massive the impacts of chemical is. Yeah, and we also have the recent one, not recent lah, 2019 in Kim River pollution. Someone here from Pasir Gudang, so I guess you are alert with these cases. Okay, so the symptom or the case has affects more than 5,000 children in that area, and surprisingly, the illegal dumpings of this hazardous waste in the kawasan, in the river, along the river, is near to the schools. And with the context of the environment, the wind, as well as lots of temperature, something like that. So that has produced a very hazardous gas, and it affects to the children in that area. And there are more and more cases that you can, have a look and see. If you like the historical cases, you can have a look. Yeah, you can read through some of this example. Okay, so what we can learn from this incident is the hazardous waste need to be managed properly. It's because it's decrease our health, it decrease the environment quality, and also they have the risk in it. Yeah. So in our field, environmental and occupational health, we always talk about hazard and risk. So what is meant by hazard? Hazard is anything that can cause harm. In our discussions today, is about chemicals. Yeah. So the chemicals that can cause harm, and the risk is the chances or the likelihood, kebarangkalian, that someone will be harmed by the hazard, by the chemicals. Yeah. So in this picture, I love to share with all the participants this picture about the shark. Ikan jaws, but by right the jaws is dia tak makan orang lah. That's not the human is not the food, but actually they can harm you. They can attack you. So in this picture, the shark is in open sea. Yeah, bare sea, maksudnya there's no protections at all. If you are, counter the shark, for example, the hazard is the shark. The shark, kalau dalam konteks chemicals, is the chemicals itself. If you are dealing with the chemicals without protections, yeah, it's like you are exposed yourself without any control measures, so the risk will be high. But in the second pictures, it shows that the sharks has been accounted ataupun being conquered in an aquarium, so the risk will be low, and then you can just expose to them. Of course, there is a risk, the possibility that the aquarium crack, ada leaking and sebagainya. But at the end of the day, the risk is quite low compared to the first situations that I showed you. Okay, so then why we have to understand why is it so important for us to manage the chemicals properly, or chemical waste properly, because it can affect our human health through variety of pollutions. It can be from water pollutions, air pollution, soil contaminations, and many more. Even though our food is also exposed to chemicals, yeah, if not being controlled appropriately, and then it also can cause variety type of disease involved with cancer, which is we are unable to really associate significantly the cancer with the chemicals exposure, because there are more other factors that also influence the disease. So it's quite difficult actually to prove that some of the diseases come from the chemicals, but it can contribute by the chemicals exposure. So apart from that, so we have seen, tadi we have looked on the what are defined by the chemicals, hazardous chemicals, what are the risks, and then now we are going to move forward a little bit on the legal requirements related to chemicals waste. And I hope that you can follow me. So in Malaysia, so we have this Environmental Quality Act 1974. So under this specific act, we have this control of scheduled waste. The chemical waste is categorized under the scheduled waste. So we have a specific regulation, which is Environmental Quality Scheduled Waste Regulations. So in this regulation, it has highlight details on how we want to manage our scheduled waste or our chemicals waste. So what is defined by scheduled waste is any waste that falling within the categories of in the first schedules of the law, of the regulations. So what are they? So they have like 5 categories altogether, and they are the 77 subcategory. Yeah, for example, the category 1 is metal and metal bearing. You have these 10 categories from SW 101 to 1110. So it's one of the example ialah waste containing arsenic, mercury, yeah, heavy metals and more. The second one is inorganic constituents. So maybe you can have a reflex back on in your workplace. Maybe some of these chemicals or some of this waste is actually the waste that you are dealing with. Yeah? In the waste in SW2, we have about 7 categories of waste, which is about from 201 to 207. One of it, for example, spent inorganic acid. Yeah, so saya rasa in lab, mostly acid is normal. I mean, is kind of the major chemicals that we are dealing in our labs. And we also have this category 3, which is organic constituent, but also can contain metals and inorganic materials. They have about 27 categories. Yeah. And the category 4 is either inorganic or organic constituent, like a clinker, slag, ashes. So these are the examples or the features of it. And the last one is other waste, meaning that you cannot identify. So one category 501, any residues from the treatment. So you cannot identify exactly whether they are organic ke, inorganic ke. So jadi that's under the SW5. So we have total 77 subcategory of scheduled waste. Yeah. So there are more here. Some of the example I have shared with the the associations, the notes, so you can get the notes and then have a look and see whether you are dealing with all kinds of these waste. Yeah. So if you are dealing with it, so you have to make sure that it is under scheduled waste regulations. All right. So in this scheduled waste regulations, it has stated in this act that we cannot place, deposit or dispose, or you cannot receive or send your waste, or you cannot cause or permit to be received or sent, or even transit the waste without prior approval from the DG. Yeah, so jadi they have a specific areas that you can dump the waste, and you have to send it in this specific contractors. Yeah, not all contractors can manage them. So if you are not, if we are not able to follow these requirements, then we are liable to a penalty of 5 years and a fine of not exceeding 500,000. And interestingly, CEO of the company also can be charged. Yeah, it's not just those who are dealing with the chemicals. And then other than that, the prescribed activities, if you want to develop incineration plants, recovery plants, also you have to get approval from the DG. So these are kind of prescribed activities that under the regulations that need a specific EIA. And apart from that, in this regulation also it highlights about that e-consignment note, meaning that when you are sending your waste, e-waste ataupun your chemical waste to the contractor for the dispose. So you have to fill up e-consignment note, and then they have like 7 copies altogether. So you have to keep it one, and there are 2 copies that you have to receive it back so that it will complete the circles. If not, then if you not receive the consignment notes appropriately, so we can trace where is the waste being located. We can locate them. It's like a GPS tracker macam tu. Okay. So for those who are dealing with the clinical waste in the hospital, so of course you wonder how this link to the scheduled waste regulation. So the clinical waste is actually also a part of scheduled waste. So these are the category of clinical waste that you have to coding, or you have to put a code of your waste. Yeah. Okay, so how to manage the chemical waste in your workplace? Yeah, so let's reflect of what we have in your workplace. So when you want to deal with it, or you want to manage this waste, you have to consider some of the important things: the generations and minimizations, the volume of it. Perhaps if you can separate them or you can segregate them, you have to identify and labeling, you have to have a proper handling and storage, safe transportation, treatment, as well as the disposal. So these are the considerations that you have to take care, or you have to, take into considerations, yeah, when you are dealing with chemicals waste. And as an employee, if it's if it's Malaysia, we have this OSHA 1994. So we have the general duties to take care of ourselves under sections 24. So of course, when you are dealing with chemicals, you are dealing with a very huge hazards, and there are a risk that it can give effects to your health. So what you have to do is you have to take care of yourself. You have to take reasonable care of your own safety and health. Yeah. So if you find it's not safe for you to handle the chemicals or to handle the chemical waste, so you have to take yourself out and then inform your boss, for example, inform your leaders, inform your ketua jabatan, your head of department, for example, and then so that we can have a very appropriate person, yeah, with appropriate PPE, for example, to handle the chemicals. For example, if you have face leaking or leakage, spillage, for example, when you are dealing with chemicals. And as an employee, as a staff, like saya, you and I, we have to cooperate with employer and also others. Cooperate meaning that we have to wear and use the PPE all the time when we are dealing with the chemicals. We have to comply with the instructions on occupational safety. We have to come to the trainings. If they provide the training for us, so we have to come. If they have, say it as is a wajib, compulsory for us. So apart from complying with our regulations on training every year, but it also on the safety and health, it's a must for us also to go for training. And apart from our responsibility as an employee to protect ourselves, but the employer, our majikan, also have this responsibility to provide a safe working place for us. So these are some of the requirements by the law. So they have to provide and maintain the safe system of work. They have to provide us with information, instructions, as well as the trainings. And when you are dealing with the chemicals, you also have to use appropriate PPE. I guess most of you are aware of this. Some of the PPE is a must, especially when you are dealing with the chemicals, like a respirator, okay? Like a face shield, goggles, and things like that. And also we have to apply this hierarchy of control in our work place. For example, if you can eliminate the process, or you can eliminate the chemical process, if you find it very hazardous, you can eliminate them, then so you have to eliminate them. For example, this hierarchy control shows us from the most effective to the least effective method. By right, the PPE is the least effective method to control us. So we have to undergo a few more procedures before we go to the PPE. If you cannot eliminate, then you have to replace the hazard, meaning that you have to substitute with less hazardous chemical, for example, or less less hazardous procedure, for example. If you cannot substitute, then you can choose to isolate them. So you make less people exposed to those chemical process. The engineering control, like for example, we have this local exhaust ventilation system, for example, LEV. So you have to do that, you have to use that. And also we have this administrative control. So change the way you work. Last but not least, the least effective is from the PPE. Okay. So these are a few more examples of how the chemicals waste can be dealing with in your workplace. For example, if you have a container, for the sharps container, you just put that. It's better if you can put just chemicals in that container. So that's more appropriate or more safe, things like that, so that you can read through and think. And it's very important for all of us to register our chemical. Why? Because these chemicals will be waste, the chemical waste. So at least you know the types of the physical states of these chemicals, the health hazard of it, the special precautions that you have to take, some of the if they have a specific way to dispose them and things like that. So that is why it's very important for your organizations to have a chemical registrations. So it's a must actually to have this chemical registered in our department. So, and again, after that, we have to provide a proper storage for them. The storage need to be compatible, durable, is able to withstand the chemicals process, the chemicals reactions, reactivity with the environment and things like that. They also have to maintain the storage area. So you have to make sure that it closed. Only authorized people can access, can have an access to this storage, because we just to protect for if there is any bad intentions that can be some bad intention that can use those chemicals against us. And then we cannot store the chemicals, the waste chemicals, beyond 6 months or 180 days, or the volumes is more than 20 tons. By right, before 6 months, and you have to call Quality Alam, you have to arrange for the transporter to collect the waste. Okay, so these are the example of how the proper storage is, meaning that you have to fencing, they have a specific fencing, you have to to close the door, to have authorized access. You have to housekeeping, clean, bersih aja, and then you have to properly label them. So this is one of the criteria or a must when you are dealing with chemicals waste. And then you have to use appropriate packaging. So these are some of the example, like pallet tank or polypropylene bag. Yeah. So the packaging needs to be compatible with the waste so that it can withstand, tahan with the chemicals reactions. The leak proof, yeah. So it will not be leaking. No corrosions, OTR, kalau rosak, kalau koyak, ganti yang baru. Robust to withstand transportations, meaning that when you transport the chemicals, sometimes you have to roll it back to the store, you have to roll it there and here. So you have to make sure that the packaging is robust to any kinds of transportations that you are practicing within your organizations. So there are more and more types of packaging that can be used. For example, we can use bunghole, you can use open top drums and anything like that. And apart from that, a very important things in the chemical waste management is the label. So you have to provide appropriate labels. Yeah? So you have to include the date of the waste generated, the name, the address of the generator, need to be clearly labeled, and then no person is allowed to alter the labels. Yeah. So there are in the regulation, it has specific label for a specific waste ataupun chemicals waste, which you have to follow. Yeah. For example, if you're dealing with something like inflammable, so you have to use a kind of specific inflammables logos or inflammables pictograms, yeah. So for your labels, so they are more. These are most of the labels that we use according to the law. Okay. And then you can use the pre-printed tape. You can use self-adhesive tape, for example, a peel-off roll, for example. You can just tie on tag table on the labels and sebagainya. So these are the examples of this label, which is you have to put the dates, you have to put the names of the waste generator, the calls, yeah, the telephone numbers and things like that. So apart from that, you also have to include the logos or the pictograms. Okay. And of course, when you are dealing with the chemicals waste, as far as chemical registration is important, inventory on your waste also is very important. So you have to make sure that you have an up-to-date inventory, yeah, according with the law. So they have a specific information that you have to fill in, and then you have to keep the record for at least 3 years. And then when you are transporting the waste, yeah, when you call, I guess in most of our practice, after we store it for a kind of a few months, and then after the amount or the volume is okay to be collected, then we call the quality alam. If it's Malaysia, the quality alam in Sabah and Sarawak, they have specific companies who are dealing with it. So we call them to transport, to collect the waste. So once we call them for this collection, so we have to make sure that we fill in the consignment notes. Yeah. So we have this e-consignment note. So I guess the person in charge know already what kind of information that we have to fill in. So the consignment note system is, they have like 7 copies of it. So each of the waste generator contractor, the transporter, the disposal operator need to, to fill in all this form. And at the end of the day, they have to submit 1 copy to DOE and also to waste generator. So then only the process of the disposal is complete. Yeah. So if you not receive the consignment note from disposal operator after 30 days, like a month, so you can just inform DOE so that they can trace where is your chemical waste has been sent. Yeah. In the case of Kim River, it's surprisingly being dumped near to the sungai, to the Kim River. So it's surprisingly being managed inappropriately. Yeah. Even though we have a very good laws and regulations, we have a very good systems to control or to trace all this waste, but unfortunately still something something also happen. It depends on whether you are aware of it, but of course when you sending to the quality alam, you have to pay, kan? So there are quite some of money lah, yeah, to dispose your waste. Yeah. Okay, so apart from that, safe transport of waste, will be provided by the company of you are hiring. They have a specific contractors, which is you can contact DOE and get the specific contractors. All need to be licensed by DOE lah. And also when they are transporting our waste, they have to fill up the waste card. So they have to inform they have to spell out every detail, single detail about the waste, like how to handle them in terms of spill or leakage, how to manage them. Yeah, so they have specific informations provided in the waste card. All of this with the intentions to protect the health of the workers, the people, as well as to the environment. Okay. Other than that, the waste treatment and disposal need to be licensed by the Department of Environment. So they have to be operated under stringent emission control. So they have such SOPs that need to be maintained. Yeah, and the trainings of the workers or the operators need to be trained with appropriate, adequate knowledge about handling the chemicals waste. And in terms of spillage and accidental discharge, they also have to come up with a procedure on how to deal with it. I guess in our lab, maybe some of you have this like a spillage kits, yeah, like they have like a powder, they have like they have a specific spillage kit that we can buy, so that in case of if you have liquid spillage on your lab floor, for example, you can just use that kit, yeah. So they have a specific chemicals that to decontam to control the effects. And apart from that, we also need emergency preparedness in our workplace. Yeah? So all of us have to have this. I think this is a must, and I think every single of us in our office, we have this emergency preparedness response. Yeah? So how to take care in terms of if there is emergency. The problem is whether we know it or not. The problem is whether we have implementing it. The problem is whether we keep noticing about this emergency preparedness. So this is very important, especially when we are dealing with the chemicals waste. So if you don't have currently, so please provide one. So there are several examples that you can follow, you can copy, and then you can just modify accordingly to your institutions. Yeah. We have this, the names of the disposal facilities, Quality Alam in the Bukit Nanas, Negeri Sembilan. I guess some of you living in Sendayan, yeah, it's quite near to this Negeri Sembilan. And also we have this Trinakans in Sarawak, and also we have some companies in Sabah as well. Okay, so we have come to the end, almost the end. Okay, before we go for the questions, I hope that you're still with me, tak mengantuk lagi, not sleeping. So the way forward, so we have looked at the character of the chemicals, what are the problems if you not manage it properly, the requirements of the law, how to manage it, and then now we are looking forward to way forward, how is it? So all of the regulations and things like that is like a tip of the iceberg. It's only cater the surface of the problems, but the real problem is actually need to be managed by how we start with our purchasing of the chemicals, whether we are purchasing over the volumes that we need, so that make it a very huge excessive amount, so we have to dispose them, or we really plan on what are the chemicals that we use. In some situations we cannot control, yes, I do understand, but still if we can do some efforts to control the quantity, to control the numbers of the volumes that we use, to plan and to buy according to the volumes, to the specific that we use, then actually we can help to reduce the effects, not just to human, but also to the environment. And apart from that, we can have a look on how to recycle, maybe upcycle, downcycles, lots of things in our workplace process, chemicals and things like that. Of course, in some chemicals we cannot recycle, but in other things like perhaps the plastic, some of the items, if we can recycle it back, or we can plan properly the usage, then we can help to reduce the context of occupational safety and health, as well as the environmental, when you are dealing with chemicals waste. And with the circular economy approach that we have currently, it's very the major the major transitions of economy in Malaysia, not just Malaysia, but the rest of the countries in the world. So they have moved towards one waste to be another one resources. Yeah. So that's, we have to move towards zero waste policy. So perhaps in our workplace, yeah, if we can apply that, of course they have challenges to do that, and then some of the process cannot definitely have to produce some waste, but if we can reduce the volume, that would be helpful. And other than that, it's very important for us to work together, and then comply with all the standards and regulation as well as the policy that we have. And then we have to have a clearly defined rules of every single of us, so that we can, have manage the waste properly, the chemical waste properly. Okay. All right. So I think I have come to the end. So we have looked at in the beginning, so on the definitions of the chemical waste, how it risks our health, how to manage them appropriately according to the law as well as to the practice that we have. And also we have to think of the challenge and the solutions, how to deal with the chemical waste in our workplace. All right. Okay, I think that's all from me. But before I leave the sessions, I would like to share with all of the participants today some of the native proverb. We do not inherit the earth from our ancestors. So we are not inherited from our ancestors before, but we borrow it from our children. So it's our responsibility to return it back to our children in a proper way. All right. Okay, that's all from me. Thank you very much. Mr. Amar, if you have any questions from the participants, silakan.
Okay, right. Thank you so much, Dr. Sharifah, for a great sharing just now. The sharing just now is very holistic yet compact and full of information. So we will now continue with our Q&A session. So I will read the question in the chat box first for Dr. Sharifah to answer.
Boleh, sila.
Okay, first question is from Ehsan Fitri. Salam Doctor, if Section 13, disposal information of the MSDS mentioned disposed in accordance with local regulation, where can we get more info of this?
Okay, thank you very much, Mr. Fitri, for the questions. If I'm not mistaken, the regulations that Mr. Fitri referring is the schedule waste regulations, I guess, okay? So if you want to know more about the contractors list or any companies where you can send off, you can just go to the website of DOE. They have specific specific list, yeah, so you can refer to that list of the local contractors, and also you can contact DOE for a specific local contractors in your place, in your company. I hope that I answered the questions.
Right. Okay, so we continue to the next question from Leila. May I know if we store chemical waste in liquid form, is it compulsory that each container to be equipped with secondary container?
Okay, thank you, Miss Leila, for the question. So meaning that she asked about a specific container for specific chemicals, right? Betul tak, Mr. Amar?
Yeah, I think so.
Okay, all right. So yeah, specific chemicals have a specific ways to contain them. They have a specific container. For example, some of the chemicals need to be stored dalam very opaque ataupun bekas yang color hitam, yeah, the black color of container for certain chemicals like peroxide, for example. But some of the chemicals can be stored in a very clear bottles. So how you want to check this? So you can check this with this chemical safety data sheets, yeah. If they have stated any of these requirements, you can check with the supplier, yeah, of how to really contain the chemicals in a proper way. And also you have to check with these regulations, the schedule waste regulations. They have a specific chemicals that can be stored together, yeah. Some of them cannot be stored together, so you have to double check whether they can be be stored in one room or in one place. So that because the container itself, if you not use appropriate container, then the leaking, the chemicals will leak by time. It's because the chemical itself, the character too, they have a specific times, according to times, and they have to you have to dispose them with according to their time, lifetime, for example. So then if you put it too long in your lab, so it will leaking by days. So it will affect those who are dealing with the chemicals. So it's very important for you to double check with the manufacturer, with the supplier, on the details of how to contain the chemicals. Yeah. I hope that answers questions for Miss Leila.
Okay, Doctor. The next question is from Dr. Nurul Mariam Hussein from HQE. Interesting presentation by Associate Professor Dr. Khadijah. Can presenter share this slide for our reference at our workplace? Thank you.
Boleh, Doktor, boleh. I have shared with the organizer, the persatuan. So the persatuan will share with you. You can just use this informations for your organizations. Feel free to use it. Yeah. If you need more informations or you need the more informative slides or anything that you want for your organizations, please let us know so we can provide you, so that it can help to spread the informations to all of our workers or all of our friends in our workplace. I hope I answered the questions.
Okay, Doctor. Next question is also from Ehsan Fitri. Doctor, can you share us example of waste card to record schedule waste SW, or is it sufficient to have inventory like you mentioned in slide 50?
Boleh repeat balik Mr. Amar, nak waste card apa?
Can you share with us example of waste card to record schedule waste? Or is it sufficient to have inventory like you mentioned in slide 50?
Okay, all right. Okay, good. Thank you very much. So if we can go back to my slide, I'll share it back. That is the waste card. Actually, the waste card is actually like you can draft your own waste card. But the informations in the waste card comes from the regulations lah, from the safety regulations, from the from the apa tu EQA regulations tadi. So whatever informations that I've stated here is actually come from the 7 schedules of the regulations, from the schedule regulations. So you have to provide the safety card. So actually they have, kalau the transporter, they already have the safety card. So you can just, ask them to prepare. But for those who yang tak ada, you have to provide, you have to come up. From where you can get this information? From the chemical safety data sheets of the chemicals, or you can just contact with DOE on how to construct the chemical waste card. And apart from it, the inventory that you have says, it is very important for us to have this inventory aligned with the chemicals registrations. So the first thing first is we have to have a chemical registrations. From that chemical registration, so it's easier for us to track what kind of waste that we produce. Is it acidic ke? Is it corrosive ke? So that's consistent ataupun in line together. So I hope that I answered the question.
Okay, Doctor. Next question is from Buva. Doctor, just need some clarification. If in MSDS it stated keep chemical in well-ventilated area, how do you define a well-ventilated area? The chemical is acetic acid. It is that it need to be in solvent cabinet, acid cabinet, or as long as it's on a chemical rack considered well-ventilated.
Okay. Very tricky question. Okay, all right. So very good question, Ms. Fova. So the first thing that she asked is about the ventilated area. So if according to the law, I hope my voice clearly, Sama?
Yes, very clear.
Okay, all right. So if it's according to the law, it says about ventilated. So how we define ventilated, it does not spell out in detail. So it depends on where we are working. So somehow the officer need to understand how they are dealing with. We have this kind of, if the chemicals can be stored in a well ventilated, meaning that you have appropriate fan or appropriate local exhaust ventilation system, appropriate air conditioning rooms, yeah, to maintain the room temperature of 28 degrees, so that it's not more and things like that. So in terms of ventilated, it depends on how our workplace is. So we have to make sure that it's not really confined, yeah, tak terlalu too many things in the rooms, yeah. So you have to make sure that it has quite airy, yeah. So yang tu semua we have to plan properly in terms of well ventilated. We have to make sure actually the design of the room actually when we come first to the rooms or to the lab, so we have to make sure that they have a proper numbers of window, yeah. They have 2 exit doors, they have kind of like kena ada basins, wash basin, things like that. So that is appropriate how we want to set up for a labs lah. So that is come to the designs of the rooms, yeah. So to make sure that they have a ventilated, well ventilated place. In terms of to store the cabinet, again, to store the chemicals in the cabinet, whether they can be stored together or not. Again, you have to double check the character of the acetic acid tadi, yeah. So that you have to make sure. And then what else? What are other chemicals that you are stored together with the acetic acid? So you just have to go to the regulations, schedule waste regulation tadi, or even you can use the ICOP on chemicals handling by DOSH, yeah. So they have stated there. So apa chemicals yang boleh diletakkan bersama, apa chemical, what are the chemicals that cannot be stored together. So it's very important for you to know, instead of acetic acid, what kind of acid that you store together in the cabinets. Sometimes it can be, put it in the one cabinet together, but sometimes you have to separate them. So it depends on again, you have to double check with this chemical safety data sheet, with the regulations to find out which of the chemicals is compatible or incompatible. Yeah? So that is all information that Mr. Pawai have to share. I hope that I answered the question.
Okay, Doctor, next question, Doctor. So from Mr. Sariadi to speaker, how long can we store chemical waste in the storage?
Okay. According to the law, we cannot store it more than 6 months or 180 days. Yeah. So by right, every 6 months, we have to dispose them. We have to call the contractors to collect, or by the volumes. We cannot keep it more than 20 tons of, if I'm not mistaken, according to the law, like I've shared in the slide just now. So if you roughly, if in UPM, every 6 months we have arranged for the contractor to collect the waste. So because by the law, it has stated clearly that we cannot we cannot store it more than 180 days. If you not follow to that numbers, then if they find out, so and of course we don't want anything to happen in our workplace lah kan. So kadang-kadang when we store it too long, the chemicals will degrade, they akan leaking, so they have produced a vaporized gas which we're not aware. So to avoid that is why they stated 6 months the max. So jadi make sure you dispose them before that. Okay, I hope that I answer questions.
Okay, Doctor, next question is from Mr. Fikri Shah. Doctor, in the lab, where is the exact place to put flammable cabinet that contain flammable chemicals?
Okay, the fume cabinets for the chemical. Where is the exact place to? Okay, again, this is the design of the lab. Sometimes kan, macam case UPM pun, the design flaws is there. Okay, sometimes lah ya. Itu tidak boleh dinafikan because sometimes the designer does not really understand the requirements where we should put the cabinet, where we should put the wash basin cabin, dekat mana nak letak the desk and things like that. Yeah. So the best part of the fume cupboard is at the back sides of your labs, the best part lah. One of the reason is because the fume cupboard comes with the exhaust ventilation system. Yeah. So sometimes when you want to do the ventilation system tu tadi, the wiring lah, the saluran. So that is all the factors that need to be counted when you want to put where is exactly the best place, kan? So that is some considerations that need to take into consideration. The best place is at the back sides of your labs, which is closely to the door, exit door, and sometimes you ada specific rooms because the fume cupboard is for specific chemicals, yeah, yang ada risk, ya kan? So that only a very high risk chemicals that we handle dalam fume cupboard. So the best is actually kenapa we have to separate them in a specific room is we have to make sure that less number of people exposed to those risks. If we can, if it is possible to be done. If it's not, then just put it at the side, at the back sides of your lab, close to the wash machine, close to the door. So in case of anything emergency, people can just run out of the labs within very short period of time. I hope that I answered Mr. Fitri questions. Thank you very much.
Okay, Radha, next question is from Dr. Nurul Mariam Hussein from HQE. Do you have info on how state in East Malaysia, example Sabah, how the state manage the chemical waste? Is it the same as Peninsular Malaysia? In Sabah, the chemical waste is the highest in what sector?
Okay, all right. To be honest, I have no informations on that, but I can helps you to check this information. The current practice that we have is in the Peninsular Malaysia. But of course, in Sabah and Sarawak, we also have this contractor, contractor, and then this regulations is actually need to be followed the whole Malaysia. Tidak terkecuali, not exempted Sabah and Sarawak. Yeah, so that's why they have to follow the same thing. But how they manage to, I'm not so sure because I hope that they also have a by right we have a procedure, kan? They have to also send it to a contractor hired by DOE. So that is the practice that should be. For further question, for further answer, whether how is it exactly, I think I have to do some research so before I, give some information. So far, I have no idea on how they are dealing with. I'm so sorry, Miss Doctor.
Okay, Radha. Next question, Radha. Hi. For expired pharmaceutical ingredients which are hazardous or have psychotropic properties, do we need to alter or dilute the expired ingredients with inert materials before packing in waste container?
Okay, all right. So pharmaceutical product is also apart from scheduled waste because pharmaceutical product, expired drugs, cytotoxic semua ini is also one part of scheduled waste. Even though dia ada clinical waste, they are clinical waste, pharmaceutical products, drugs, expired drugs and things. So they have to be separate in specific plastic, yeah. So there are specific plastic, specific labeling according to the guidelines of clinical waste management guidelines. So I guess KKM has a specific guidelines for a clinical waste. Yeah. So you follow that because that guidelines are also consistent with whatever the requirements of DOE is. Yeah. So they have specific bags. So you have the drugs need to be contained in a specific bags. So then you have to store them together, and then it is labeled under the scheduled waste, which is have to be managed accordingly to the scheduled waste regulations. You have to send it to the incinerations. Yeah. You cannot just throw it together with the other general waste. It cannot be, yeah, because that is under clinical waste. The clinical waste is under scheduled waste. So you have to dispose them according to the scheduled waste regulations. I hope I answered the questions. How they want to start macam tadi separate ke tak separate ke, they have to follow the the guidelines of the clinical waste management. We can have a look on that. They are the specific regulations. They are the specific guidelines. Kalau you all interested, we can share with that nanti in the next in the next maybe webinar.
Yeah. Okay, the next question, Doctor. Salam, Doctor, from Oakridge, OK. Salam, Doctor. Is it enough to do our own internal chemical risk assessment only without appointing outside auditor? Because we knew that appointing outside auditor could be quite costly.
Betul. Yes, that's enough. Kalau if you go to the DOSH requirement, kita you can use you can do your own assessment of CHRE. Yeah. If Mr. want to know more detail, we can share with you about this our internal kind of self-assessment CHRE. So you have the biggest important information that you have to gather in your lab is the chemical registration first. Whatever chemicals that you use, you do the registrations. You do the chemical registration. It's just a simple Excel file. Yeah, you can just download from the website of DOSH. You can just follow the regulations. So what they have to identify that really worried about CHRE. You can do your own CHRE by your own. You can assess by your own, and then whenever that you have enough funding, yeah, you can call this CHRE assessor to maybe to validate. Yeah, it's maybe more cost effective. Yeah, more cost effective. They have to just validate and then just come and check whether they have to. If the problem is sometimes our chemical kan bukan je 50 je chemicals kan, sometimes hundreds of that is why the cost is very expensive, because they charge every single chemicals too. If you have, like, for example, in UPM we have like thousands of chemicals. Some of the staff kan for this CHRA competency, then the staff of your organization can helps you to do the CHRA. So jadi that is how we cut some cost lah. Tapi it's okay to have your own self-assessment. No need for the CHRA if you don't have funding for that yet. I hope that I answered the questions.
Okay, next question is from Micro HSJ. Can we send the chemical to Agenta for them to dispose?
Agenta tu, if can I know, Agenta is a company or it's a contractor, or I'm not so sure about the Agenta, but let me check first. Yeah, if it's a contractor that is licensed by the DOE, tak ada masalah. So you have to double check lah whether it is a licensed contractor or not.
Okay, the next question is from Mr. Ahmad. Doctor, what if there is a chemical spillage such as formalin in the OT room? What we should do?
Okay, formalin Okay, formalin ni we know lah, the effects to us too. It can be change our behaviors. Yeah, it can also affect our respiratory systems. Yeah, and also it's like they produce a very specific smells of formalin. Yeah, it also happened in our lab in UPM. So because kita punya lab pun bawah tu adalah tempat where we have formalin being used. And then these gases of formalin has been dispersed from ground level towards upper side of the lab. So it's quite tricky to do that. In case of spillage, actually we have a spillage kit we can use. Yeah? So every single lab actually have to buy these spillage kits. Yeah? If the amount is not too many, too huge or too big, the spillage too, you can just use the spillage kits. Yeah, they have like a sabot, have a powder, and they have a specific ways on how to use it. Yeah, so you have to use it appropriately according to the. If the formalin is too banyak sangat, it's too many, so you have to call for the hazmat to help. If it cannot be controlled, but somehow if it's still small, dalam quantity, very small quantity, we can just use the spillage kit. Tak ada masalah. Alright.
Okay, Doctor, next question is from Ms. Nurul. Hello, Doctor. How about expired powdered media for microbiological work? How to dispose it?
Okay, so the expired micromedia, how to dispose it? I think this is under the clinical. You can put it in under clinical waste as well. So you can just separate them with other kind of general waste. Put it in specific bags, like the yellow bags, and then because the blue bag, selalunya clinical waste, the blue bag is for autoclave, kan? So kalau media yang dah expired ni, so you can just put in the yellow bags and then put it together in the clinical waste or in the scheduled waste together. So there is no problem. So you can just dispose them according to the scheduled waste management. Okay, I hope that I answered the questions.
Okay, Doctor, next question from Mr. Ash. Doctor, how to know a chemical waste is considered as a schedule waste from SDS?
Okay, all right. How to check? You have to check with the tadi regulations just now that I have shared with all of you. The Schedule Waste Regulation 2005. So they have a waste category, kan? They have like 5 main category. We have 77 subcategory. So you have to double check whether your chemicals tu in which part. Even though dalam regulations tu they are not spelled out in detail, kan? Dia cuma katakanlah dia kata spent inorganic acid, itu je dia tulis. They're not put it in specific what kind of things. But so you have to understand the nature of your chemicals so you can categorize them accordingly to your to the waste category. Somehow in our practice, kadang-kadang when the residues or the chemicals after we use tu, we cannot identify pun because they have a mix. They already mixed, kan? Contohnya acid dah campur alcohol, dah campur pelbagai, it's a mix of chemical. So that is you can identify it as something like other waste, like in category of 501. So that is we cannot identify the nature of it, but still it have to be under the schedule waste. For details of what you have to how to specific it according to the waste category too, Mr. Ash has to check back with the regulation study and see your chemicals too, you can put it under which category. I hope I answered the questions.
Okay, the next question is from Ms. Bhuvanesari. Doctor, is it compulsory to keep SDS in both English and Malay?
Oh, okay. Very good questions. Yeah. It's a compulsory. It's a compulsory to have one copy in national language. Yeah? For example, in Malaysia, Bahasa Melayu lah, and followed by the English versions of it. And the SDS can be, a must have in a physical state of form as well as the soft copy. So the best thing is in your practice, you put one hard copy in the rooms, in your office, and maybe one copy of hard copy in the lab, for example, where the chemicals is, and one soft copy maybe in your WhatsApp group ataupun if you have Google Drive, kan. So in case of emergency, katakanlah tak sempat nak tengok physical one, you have this soft copy. Sometimes somehow sekarang ni easy, kan, you just Google, you just trace the names, you can get the SDS. Yeah, so by right, and then sometimes when you buy the chemicals from other countries like China, Japan, they come up with the SDS in their language. So what you have to do, ask them to translate in English for you, and then you can translate it in Malay. So it's a must to have both national and also English versions in our country. And apart from that, if you want to do more language pun tak ada masalah lah. It is additional, kan? And also you have to put it in hard copy and soft copy. Dia sebenarnya in the regulation doesn't say should be soft copy or hard copy, but in the practice too, it's better to have both.
Okay, Doctor, next question from Mr. Muhammad Nur Mansur. Dr. Sharifah can advise how to prepare waste card for mixed chemical because the mixtures are difficult to determine the physical properties of the chemical, for example, the pH, density, FP, BP, etc.
Betul. Yeah, saya agree. I really agree with that. When you have a mixed chemicals, it's very difficult actually to identify macam mana nak handle spillage dia, macam mana nak handle in terms of emergency, apa PPE nak guna dan sebagainya, kan? So in terms of that, the best, I'm not so sure, the best practice is you have to make sure if you have any idea of any informations, what are the highest risk of the chemicals in the campuran in the mix, if you have. If you don't have, then you can consult DOE on how to do the waste card. You can just get the general statements lah, like for the mixed waste. So they have a specific waste card for a mixed waste, which you can just get it from the DOE and follow that for your company or for your organizations. If you want to do by yourself pun tak ada masalah. You can identify based on what are the highest chemicals in that the highest risk in the compound, that you can use that because yang tu the paling safest, kan, if we can follow that. And you also can contact DOE for the general mixed waste of waste card. Tak ada masalah. I hope that I answered the question of Mr. Mohammed.
Okay, Doctor, next question is from Mr. Baskaran Gopal. So in the hospital compound, how far chemical waste stock can be situated?
Okay, all right. Okay, very interesting questions. Berapa jauh? How far we have to? Sebenarnya as far as possible lah. So actually we have in the guideline it doesn't state in details or specific tapi but in our practice kalau dalam we have another guidelines on chemical storage by Department of Occupational Safety and Health. According to that guideline, the storage of the chemicals need to be as far as possible from the community. Tapi dalam praktis biasa kalau dalam hospitals, because we already have design kan the bangunan, so as far as possible that we can go further lagi baik lah. Yeah. So I can't say, I can't give the exact berapa distance lah. Tapi we have to check sebenarnya, we have to really think back or look at back of our capability dekat hospital atau kat mana-mana. If we can put it as far as possible, that's good, best enough. Kan depends, tapi the storage area pula need to be closed, need to be apa tu, authorized person je yang boleh access, need to be locked. Kalau dah jauh sangat pun, it's very far away pun problem juga kan. So jadi kena tengok lah. So the exact number tu saya tak ada. Cumanya kalau dalam regulation dia kata not apa tu 500 meters and away is the best within the community area. And also dalam chemical storage kita akan ada stacking. Stacking tu dia ada tulis lah, the stacking of the drums is about 3 meters kalau if you don't have rack, kalau tak ada rack. If you have the rack, then it can go more than 3 meters. Itu yang dalam guidelines lah. I hope that I answer Mr. Baskaran questions. Very tricky.
The next question from Mr. Faizul. Salam Doktor, untuk store simpanan chemical waste ada specific design by DOE ke sebagai rujukan?
Okay, ada. Untuk there is a specific specific guideline lah, dia tak ada specific design, but the specific requirements, for example how many doors that you need. Anyway, we for any buildings we have to follow the UBBL law 1984 tu. So they have spelled out how many windows, how many doors, that is a must to be followed for the designs of the room. So by the guidelines of the DOSH also have stated for specific for chemical storage. So dia ada banding, you have to provide banding, you have to have fencing, so dia ada specific on the requirements. So if you want to have further detail, you can just go to the website DOSH and then download the guidelines of this storage guideline for the chemical storage warehouse. Dan kat situ they have specific details.
Okay, Doctor, next question is from Mrs. Nur Ajiba. Salam Doctor, for chemical waste that mix with biological waste, for example blood or urine, do we treat and dispose waste as chemical or biological waste?
Okay, kalau mix waste, kalau mix antara chemical dengan biological, it depends on the keadaan lah. It depends on us. Kan? Sebab kita je, we as those who are involved with the waste, we actually know which character of it the best. Tapi in that konteks tadi, dalam konteks Nur tadi, we can categorize it as mixed waste. Mixed waste, tapi kategori schedule waste. Maksudnya mixed waste have to be have to be managed according to the law of regulations of schedule waste. It need to be incinerated. It needs to be sent to quality alam. At the end of the day. So if you cannot separate them, no need to separate them, because sometimes we are exposed to the risk, kan? So we try to reduce the risk exposure to us tadi. So if it's mixed, let it mix. So then you just categorize it as a mixed waste. So tak perlu nak categorizekan dia specific lah. But somehow if you see dia ada percentage, if you think that this is more towards biological, then you can just categorize them as biological. If you think that percentage dia more like towards liquid, then you can just towards liquid. Tak ada masalah on that.
Okay, the next question from Mrs. Sumaya HSAJB. Salam and hi, Doctor. for chemical waste store, the place where we store chemical before being taken by concession company, is there any specification in terms of temperature and humidity or etc. from DOSH for the chemical waste storeroom?
Okay. Kalau dalam capacity from the DOSH guidelines, for the room in terms of temperature, first you have to double check what kind of chemicals that you are dealing with. Some of the chemicals you have to double check the boiling point lah, from the SDS study. So whether it can be stored outside or it need to be stored in the room temperature. So that is very important for you to check. If the chemical can be stored outside, so tak ada masalah in whatever temperatures that they are exposed to. But if the chemical cannot stand very high temperature, it needs to be stored in a very enclosed room. Enclosed room pun kena tengok juga, and this macam tadi saya I mentioned just now, you have to double check the compatibility of the chemicals juga. So whether it can be stored together with other chemicals or not. Macam tadi case puan tadi tu, because it has been taken, the place has been taken, tapi jangan risau, don't worry. Find out whether you can just put it outside. If it can be put outside, then tak ada masalah. According to the regulation, there is no specific temperature, but they ask us to check this character with the chemicals SDS tadi, safety data sheets, because like I mentioned, some chemicals can be withstand very high temperature, outdoor temperature. Some chemicals cannot. Some chemicals need to be stored dalam bekas yang warna gelap, opaque bekas yang gelap. Some chemicals boleh disimpan dalam bekas lut sinar, transparent. Yang itu kena double check. And I guess as a science officer, yang tu memang terror dah. They already know whether this chemical can be stored outside ke, inside ke, what kind of container. So they already experts on that. So I guess you guys can do that very well.
Okay, Doctor, another question from Mr. Mokri. Salam Doctor, let's say we use expired chemical and our quality control still pass when we perform a procedure or laboratory test, and the result obtained also seem okay. So what do you think on this? Is it okay to use the expired chemical, or we just discard the chemicals even though the QC seem okay, result okay, everything look fine?
Okay, susah juga lah, very tricky. Thank you very much for the questions. Semua okay, quality control okay, tapi dia expired. Okay, alright. The reason why we need to dispose the expired chemical is because we understand the character of the chemicals ni, dia ada degraded time. Maksudnya by the time dia dah tak ada function ataupun function dia dah kurang, the effectiveness of the chemical has reduced according to time. Contohnya macam kalau radioaktif, we call it as the lifetime lah. So as reduce the lifetime, the effectiveness of the chemicals may be reduced. So but in this case, quality control okay, everything okay. So, but again, kalau dalam konteks, I'm a researcher, so I will answer biasly lah. As a researcher, I really need very up-to-date chemicals, even though the quality control is okay. But, tapi, for example, if it's for teaching, for example, kan, and then the result is not, it's just for teaching purpose lah, to teach the student, tak ada masalah lah. Kalau quality control semua okay, bolehlah guna, you can use it. Tapi sebenarnya, the dispose of the expired chemicals is important because we don't want it to affect the health of the officer tadi, because the chemicals with the time tadi, they will degrade. Maybe they will interact with the containers, so they will leakage by time. They ada seepage sikit-sikit, the gases and things like that. So that is what we are worried, not really about the measurements. Untuk macam cost effective for the teaching, maybe you can use lah because the quality control is okay. But for the research that you need to publish the paper, the result need to be accurate. So the best is to use very up-to-date punya chemicals lah. I hope I answered the questions.
Okay, Doctor. Next question, we have like a few more questions. Next question is from Ms. Juanita. Good afternoon, Doctor. Which company can we approach to get this chemical spillage kit? Roughly how much will a kit be?
Okay, sebenarnya ada banyak company banyak company that you can approach on the safety side, on the occupation safety side. For example, if you are in your organization, they have a safety and health, occupation safety and health committee. Approach them and ask them the supplier, because they have a specific supplier like 3M. Kita ada banyak company lah yang offer this spillage kit which we can buy. And then also from the chemical supplier, if you ask them, they can provide a few supplier that has been approved by the DOSH, and also a well-known supplier atau well-known company to provide this kit, and then you can just buy it. The price, the harga, it depends lah. So dalam satu box tu, if I'm not mistaken, dah lama dah beli, maybe dalam mungkin for 100 or 200s, depends on the size. So the small tu maybe dalam 200 dah boleh dapat lah, 200 or 300, something like that. Okay, so that one that can be used, so each lab mesti ada, must have that in case of emergency spillage lah, kan? So tak payahlah call bomber, dia macam kadang-kadang benda yang boleh, if we can control, kalau bomber pun, the principle of actually fire hazard ke chemical, the first thing is, if you can control it by yourself, you control it first. Kita yang kena control dulu. We have to. Kalau dah lepas kita control, kita call bomber for mungkin validation. Ada lagi tak chemical spillage tu? Dah bersih ke belum? That is we call for hazmat team, kan? Kalau tak perlu, tak payah. Macam kalau dah spillage kit tu, dia akan dia akan neutralize the chemical back. So there is no problems with that of we doing our own. I hope I answered the questions. Panjang pula jawapannya.
Okay, Dr. Last question from the chat box from Zamzuria HSNZ. Salam, Doctor. How often do SDS or MSDS sheets need to be updated or replaced? Thank you.
Okay, all right. Thank you. Very good questions. Actually, the SDS need to be updated if there is a changes in the ingredients in the process. That will be notified by the manufacturer. Kita sebagai end user, we will never know about that. So and in one sections of the SDS, if you see section 16, paling last tu, the last informations, they will stated the updated bila the last update. So by right, by laws, for each 5 years, setiap 5 tahun, they have to revise it. Or if there is any changes in the ingredients or whatsoever characteristic of it, the classification is changes, they have to provide us with the new SDS. So as a science officer, you can double check your safety data sheets. If it's more than 5 years, call your supplier and get it the new one. Sometimes there is a changes, sometimes dia lupa nak bagi tahu kita, kan? So you have to double check on that lah. Thank you very much for the questions.
Okay, is there anyone want to ask Dr. Sharifah? I saw someone raise hand just now. Mungkin dah tak ada kot.
Tak ada question.
Mungkin sudah terjawab soalan-soalan.
Ya, betul. Jawab dah.
Thank you. So with that, we have already reached the end of our webinar. Thank you so much, Dr. Sharifah, for joining us and give some great sharing to us about chemical waste management. And also
Thank you.
For all. Okay, there's a question from Dr. Arsha Aladdin. Yes, can Doctor? If anyone wants to unmute and speak to our speaker today, can also do that. A question from Dr. Arsha Aladdin. Inflammable chemical must be stored in inflammable chemicals.
Okay, apa soalnya the chemical? Inflammable chemical must be stored in inflammable chemical.
Mungkin facility dia tidak menyediakan inflammable chemical.
Oh, okay.
Inflammable chemical storage kot.
Storage lah. Okay. Alright. Sepatutnya dia kena a specific area lah, inflammable cabinet ke, kan? Sepatutnya. Tapi by right, dalam our building pun, UBBL law tu, they have stated that our building design have a capability to capture ataupun to hold the fire of certain periods of time. So if you don't have this inflammable cabinet, it's okay, but just store it in a very good, well ventilated rooms with a door yang boleh tahan api, yang yang a very good one, yeah. So because dia inflammable kan, so and then double check juga, sometimes we can store it in separate room. Selalunya yang berbahayanya we separate in kawasan yang jauh sikit daripada lab, for example. But somehow we have to check jugalah kita punya kekangan kan, limitations, yeah. I hope that I answered the questions from Dr. Arsha.
Okay, I think this is the last question, because we already reached 12:30. Good afternoon, doctor. Must the SDS be the same brand as the physical chemical? Because the chemical is a long time in our workplace and still in use.
Okay, by right kena sama lah. The SDS cannot be, it's okay if you don't have the same brand, but the same character chemical. Contohnya kalau acetic acid, the SDS tu acetic acid lah, no matter what brand it is. Selalunya the SDS tu memang by the chemicals, it's not the brand. Tapi sometimes, because sometimes bila brand tu, the company is no longer exist kan. So jadi the best thing is if you buy from specific supplier, get it from that supplier. Minta supplier tu yang berikan pada kita, because that is their responsibility to provide us with the updated versions of SDS. Kalau boleh call supplier balik lah. Kalau tak boleh, it's okay, you can just use the general the chemicals of the SDS. Yeah, saya harap saya menjawab soalan Juanita.
And another one last question from Miss Maya, she's a JB. Flammable cabinet without the cap or filter installed, is it safe to use?
Oh, tak ada filter install. Sebenarnya by right tak ada masalah lah, because it's depends on keadaan kan. Kalau if you can have a very appropriate one, that is okay, it's a good if you can have this filter or cap, but if you don't have that pun tak ada masalah, because if you have to make sure the cabinet is in a very good conditions, the room is well ventilated, you have to consider lots of other factors as well, not just the cabinets, yeah. But at the end of the day, please don't be too rigid on the, but you have to be very flexible on in terms of the cost, your own capability, whether you can provide that kind of cabinet kan. So if you cannot, then you just use as far as practicable for your company, for your organization. Itu pun tak ada masalah.
Okay, one last question from the audience. Dah banyak kali one last ni. How do to translate SDS in Malay? Any apps to use? There are a lot of SDS if you want to translate, or manually, or can we ask company to translate?
Okay, the best is kan, selalunya kalau dalam kalau kat universiti ni kita buat back to back translations by our own. Contohnya from English we translate back to Malay, and then we translate back to English. So then with the back to back translations we can have a very good translations on Malay. Appropriate kalau apps ni banyaklah apps kan, tapi nak kena double check by human juga. AI pun boleh sebenarnya, tapi kan dia translate yang bukan-bukan. So the best is kalau if you are in the institution, university kan, so ask the lecturer, or maybe pegawai sains pun boleh buat. You translate it to Malay language and translate back to English versions, and then you can see you will get a very good translation back to back. Ataupun you boleh go with a specific mereka yang pakar bahasa to translate for you. Macam itulah. I hope that I answered the questions.
Okay, thank you so much,
Okay.
Doctor. Thank you so much for answering all the questions from our participants, and thank you also from the participants for giving a very engaging and very interactive session for this webinar. And don't forget to fill up the attendance form and also the feedback form. And any questions about this webinar, this session, you can send us an email at pegawaisains@gmail.com. I would like to share some slides from the organizer before we end our session today. Okay, so this is our organizer, which is Persatuan Pegawai Malaysia, PPSM, or Malaysian Science Officer Association. So the organizing committee of ISW 2024 is advisor Yu Ki Chem. The chairman is technologist Muhammad Zahimi Yaakob. Deputy Chairman is Ahmad Zakwan Mustafa, and the other committee members is Technologist Chemist Hazim Shahmi bin Elias, Technologist Anjali Ambaya, Madam Nofaradina binti Padi, Madam Vidobala Balasegar, Mr. Syed Ahmad Tajuddin Tuan Johari, Madam Masita Berjalil, Miss Bisharli Omar, and Mr. Muhammad Zul Ahmad bin Aslan. I think that's all from us. Thank you so much, and see you guys in next webinar.
Thank you very much, everyone.
Thank you very much.
Take care. Assalamualaikum.
Doctor, thank you so much, Doctor, for joining this webinar.
Thank you, Mr. Ammar.
Yes. Doktor, saya ada satu soalan.
Apa dia?
Saya ada satu soalan.
Apa dia?
Doktor orang Penang ke?
Dok. Apa dia? Encik Ammar cakap apa tadi? Saya tak dengar.
Itulah soalannya. Doktor orang Penang ke?
Oh, dok. Tak, bukan Penang. Okey, saya keluar ya. Thank you, Encik Ammar.
Okay, right. Thank you so much, Doktor.
Bye-bye. Assalamualaikum.